Okay, are we ready?
We are ready.
Okay. Hi, everyone. This is Lindy Hinman, Vice President of the board. I call to order the Boulder County Board of Health's regular meeting. It is October 20th and it is 5:30 p.m. Could I ask all the other board members to introduce yourselves? Amber? Yep. Amber Johnson, board member. And Landry?
Landry Fagan, board member.
Thank you. And I don't think Morgan's on yet, correct, Patrick? Oh, there she is. I'm rolling in. Morgan, we should.
This is like my last official meeting. I'm gonna do this, right?
Exactly. I was hoping you would do it.
Hi, there I am.
Okay, Morgan, you want to formally introduce yourself?
Yeah, I'm Morgan McMillan, president, just for the next hour.
Okay, we have a quorum. We are missing Stephen. He is traveling, which is lovely, taking an amazing vacation. The notice of this meeting was posted on the Board of Health website, and the calling information and address is included to allow for public participation. I think we're now going to move into the agenda. To start, item number 1 is public comment. Patrick, do we have anyone on the line?
We do not have anyone submitted for public comment today.
Okay.
I think we have anyone on the line. Nope.
Okay, great. Not great, but item number 2, approval of our prior month's meeting minutes. For the board, these were obviously in your packet as always. I make a motion to approve the meeting minutes from our last meeting, which was September 8th, 2025. Could I get another board member to second that motion? Second. Thank you. And I'll take an all in favor of approving last month's meeting minutes. Aye. Aye. Great. Motion approved. Okay. We are going to move now into the rest of the agenda. The first agenda up is item number 3, which is strategic priorities for our mid-year update. And Lexi, I will turn it over to you to start.
Thank you, Lindy.
And maybe
Lexi.
immediately to Kelly.
Team up multiple people.
Go ahead.
Go ahead, Lexi, or you want to say anything? I'm good.
I'm Lexi Nolan. I'm the Executive Director of BCPH, and I'm happy to turn it over to Kelly Hinch, our Strategic Initiatives Branch Director.
We all work so well together. So yeah, thanks so much. This is one of our quarterly updates for the strategic plan, sort of the biannual ones. We did talk about the indicators during the last meeting. So
I'm sorry, that's great.
that's salute the air when I'm one right there. And so really some of the data that some of the updates, these are from the strategic priority leads. And so Rachel Mindahl, who's our health planner, and Elise Vaughn, who's our health planning evaluation manager, are going to lead a presentation. I know they send out the docs to y'all, but it's really focusing on sort of the updates through Q2 because our cycle, the Q3 updates are coming soon, actually. And but we do have some verbal updates from Q3 already with some of that space as well. So I will let them go forward and do the presentation of sort of the strategic plan quarter updates.
I can jump on in, just making sure I have control, right? Patrick and George.
Yeah, you should be able to take control.
Okay, I think I did. I just wanted to make sure that
Yep.
we'll test it out when I switch to the next slide. Hi, everyone. Rachel Mindahl, she, her pronouns. I'm the health planner, health planning and evaluation team. It's just here last month. Thanks for having us again. Today, let's test out this. Yep, great, got control. So today, like Kelly said, going to be providing kind of a general update on the strategic plan. We have these kind of spaced out as biannual updates to you all. The timing of this, I will admit, is a little funky. Most of the content in here, the data is from Q2, which you received that report in August. Q3 you will get next month, but because of the timing, we weren't able to put the Q3 data into this presentation. So pulling out some of the highlights from Q2 to focus on, I can verbally share some updates from Q3 that kind of build on that. And then you guys will get the full Q3 report next month in your packet files. So again, focusing today mostly on general strategic plan updates. I do have a couple of slides on following up from last month's meeting. There were a couple of questions about the indicators, so I'll talk through those. And most of what you will see here today was also included in your packet file as well. So. All right, so to start, just wanted to kind of refresh everyone's memories, including my own, on the different ways that we as BCPH report to you, the board, on our strategic plan. So you do receive monthly updates in the director's report from the strategic priorities. These are usually pretty brief updates if there was anything to update on. I know sometimes priority leads, not much has happened in the last month for a variety of reasons. So just kind of some brief updates in the director's report. Then we have the quarterly reports. Those are the static updates. We share status updates for each of the activities, as well as, again, a little bit more narrative on what maybe has happened. Biannual updates, again, that's today, presenting to you all, giving a little bit more time to the strategic plan to talk a little bit more about what might be going on. We did plan out this year to do some priority deep dives. This was instead of, I think one of our first presentations, we had all of our priority leads here and they all presented and each one was given 5 minutes each, which is not enough time for you all to ask questions and for them to share the work that they're doing. So then we tried to switch to priority deep dives, which would allow the priority leads and work group members the opportunity to come and have more of that two-way discussion as opposed to kind of the static reports that you receive. So I know we did STS and emergency preparedness towards the beginning of the year. We had a couple scheduled. I think there was supposed to be one August, September-ish, but based on the priorities, wasn't a great time for them to come in. I think we have 2 more scheduled at the end of the year, but we'll touch base on if that's appropriate given some of the changes that have happened. And then the last one, the Strategic Planning Subcommittee, which will be starting soon, I think, but we're excited for that one. Again, just another opportunity to ask some detailed questions to get some more feedback, just to plant a little seed. I would love to review this reporting structure with the Strategic Planning Subcommittee just to make sure that what we're doing is fulfilling what you guys need, the information that you guys need. If we need to adjust anything, it'd be a good time to do it at the end of this year as we start planning for next year. So if it's working, great. If it's not, we can adjust.
Does it feel like it's working for staff? It feels like it's a lot.
It is.
I mean, right? Again, you guys can talk about the subcommittee, but that is my initial reaction to this. It's like, wow, it seems like a lot of reporting.
It can be at times. Yeah.
Okay.
I mean, I don't want to speak for the priority leads. So just from the gathering, I mean, I don't gather all of that information. The priority leads put in all the information, so I don't want to speak for them. But it can be, some of it's very duplicative too, if not a lot has changed.
Yeah.
As a current interim priority lead, I will tell you that they do a great job of making sure that we stay on track. And it's a great reminder to look at it and say, okay, we accomplished that, we're doing that. So
it's an accountability tool.
it's an accountability tool and it's not too much
Okay.
reporting.
So we do have other priority leads in the room. Like you said, we can dive in with the subcommittee and kind of reassess at the end of the year and see what makes sense.
I'll say it is helpful to report back and reflect on the work that you actually do. To go back, oh yeah, we did do that thing.
Yeah.
So that's helpful. We do report a lot on our work. And I think reporting is important. It is an important accountability tool. But I think there's room for it to be tweaked.
Yeah, I just, yes, us 3 are priority leads here. And I feel that also, I think some of this work will play into planning, right? As we look forward, I think we haven't necessarily stepped into that planning space from this work quite yet as much as we probably could, right? So it's not only just accountability or looking back at our work and things like that. It's also about, hey, looking forward. It helps people center themselves in that space, which I think is really relevant because we're torn in so many different directions with so many different things that, there's things that I need to report on and stuff's been, we're ahead of that, or we're not even close to that, right? And things. So it helps us in that as well. I think it's manageable, but I do feel from the beginning, we've been flexible, or we build in a lot of flexibility, and Rachel does a really good job in being that nice planner that reaches out and says, hey,
Gentle prod.
you know, things like that. So
I will say, and I think just to reiterate what everyone shared, I think the one other thing to be mindful of is we want this to be useful to the board. And so I think, yes, there's ways that we can build in that accountability piece for our strategic priority leads. But I think what is very useful for our team, and I think for the priority leads to know, is that the board has actually viewed that and they find that information valuable. So to Rachel's point, I think as we're talking about the subcommittee, talking about like what Kelly's saying, planning for next year, having that opportunity to touch base and see what pieces are working, what pieces aren't working would be wonderful. So we're excited for the subcommittee to kind of dive into that space.
How much of the work do you guys feel like at this point is weighted to monitoring versus evaluation versus learning? And then how much adjustments happening as a result of this activity?
I would say learning, we don't report as much on learning, based on just kind of some of the narrative updates. A lot of the updates are, things that have been accomplished, things that, maybe some challenges they've run into. There are some adaptations in there, but I would say we probably could focus more on learning. Again, I think we could adjust some of the reporting, so we have more of that time built in for them to reflect, for priority leads to kind of reflect on the learning piece. It's only been a year of implementation, and I feel like it's been a bit of a chaotic year for the agency, you know, so I think with time, we'll kind of keep learning on this learning plan, and we can adapt to that. Separation between monitoring and evaluation. I'm sure to answer that one.
Yeah, and I see your hands raised, Kelly. You want to go first or?
no, you go ahead.
I would argue that we are largely still in this monitoring phase because we are still very much getting the data systems off the ground to actually quantitatively monitor and evaluate these. To Rachel's point, I think our priority leads do a great job as thus far reflecting on evaluating what are they learning about this process. In terms of like the more formal pieces of monitoring, evaluation, and learning, I would say we are still very much setting up the systems to do that in a routine way. So again, I think that's why it would be valuable to revisit this plan with the board of as we're getting more of these systems online, as we're building more consistent cadences, what balance would you all like to see? Where would you like to see those narrative updates where maybe to, Jordan's point, the priority leads are reflecting more, talking about what they're learning, what they're adapting, and how often would you like to see the quantitative pieces and when do you want to see them in concert together? So that was my rambling answer, Kelly. What did you want to share?
I think that's fine. I can also ramble. And with that, I think that intent has been there from the beginning, right? I know that when we spoke with Lexi in particular was really working with us on this learning space. I feel this is like a puzzle, right? In that we're bringing these pieces together, right? And we'll learn once we can see a bigger piece of that puzzle a bit more. And I know that's kind of a weird thing to say, but I think there's some, like Elise was saying, I feel that we're building these other spaces and there's also a cultural shift around learning like that needs to occur. And I feel that as we build in that process more formally, if people step out of priority-based budgeting as all encompassing and all concerning to them, to themselves, their teams, we start jumping into this space, I feel that people will probably go toward that learning piece. But it will take, it's just part of that continual cultural change that we're seeing as well. But yeah, it's a great point, right? We're like, and I agree with Elise right now, a lot of it's just monitoring to make sure how far we've gone, what's it look like.
How much of this is like useful then to go towards the grant reporting requirements? Like, is it helpful to have this stuff because you can then reuse it, or is it just for this purpose?
What a great question. It'd be great if we could eventually use it for grant purposes, but it depends, the strategic priorities aren't necessarily program specific, so.
Or grant specific.
Or grant specific. I think ideally down the road, it would be, we could use this. Right now we're except for once a year, we are only reporting on status updates and some narrative. The quantitative data that might be helpful for grants would be more like the end of the year, kind of the indicators that we talked about last month, in my opinion. But I'm open to other thoughts on that one.
This is largely reflective of what's happening within our strategic plan. The data pieces that that Rachel's speaking to, I apologize. That's really tying into kind of these beyond just data monitoring for the strategic plan, tying into this performance management work that we also are getting off the ground and running. So I think the short answer is this doesn't explicitly tie into any of our grants that we are aware of. Obviously, there are various grant-funded programs who contribute to this work, but to our knowledge, they're not lifting the language verbatim from this to feed into their grant reports. Where I see that probably happening more often is when we get into that programmatic KPI work, where that is much more connected to specific programs, specific operations and whatnot. Lexi, I see you raised a hand. Yeah.
You
Waiting
took
patiently.
the words right out of my mouth,
Okay.
Elise. Yeah,
Great.
I think that, you know, the early stages of this work has been a bit inductive. It's what do we have? What can we build on? And I think as we strengthen our rhythm of having a strategic plan and having a shared vision of what it means, that we'll start to see more of the strategic plan being reflected in our grant proposals. Whereas right now we're seeing more kind of past grant proposals being reflected in our strategic plan. I think that balance will shift a little.
Thank you, Lexi.
I'd like to add, so we're currently kind of building the foundation for the grant office. And so we have it's not published yet, but it's a preliminary grant handbook, and it has the life cycle of the grants. And so one of the components that's missing within our grant cycle is the last component, which is I think it's step 9. So we have this visual and this grant book that's going out to all employees. They're all getting trained right now, and that is the reporting. So we'll be able to get a lot of data from there to be able to use that for future, submissions, even for the dashboard that we currently have on the grants. I think that's where we'd use a lot of the data that we're collecting, but I think it can definitely probably, expand on the priorities. But I can say that separately, we're building the grant office that has those performance, because we get some grants, but we don't do a good job telling the story. What were the outcomes, right? We get this funding from them, but we're not giving the outcomes. So we added that to the grant life cycle. And I think we'll come to the board and kind of give you a preview of the grant office and the grant handbook people are actually doing trainings right now, and we'll be implementing that.
And that's just to flag that, Armando. That's really wonderful to hear, because I think that's news to us as well. And we will definitely want our programmatic KPI work to meld into that fairly seamlessly. So to your point, we're not having people duplicate efforts or duplicate data in multiple places. All of this contributing to this beautiful, grander scheme of data modernization at BCPH. Slowly but surely chipping our way at that. Sorry, back to you, Rachel.
Any other questions on this slide? Okay. So the next couple slides again are focusing on the Q2 data. So I will try to kind of speak to some of either the highlights or some of the information leading into Q3. So it's not a complete repeat for you guys, but maybe it's a refresher because it's been a couple of months. Mm-hmm. So again, quarterly reports, static reports. Up on the screen, we have the status of all 61 of our strategic priority activities for Q2. So we had 46 that were reporting to be in progress, 15% completed. I need to look at my own screen because I'm not sure. The colors are up there. 2% are behind schedule, but 7% discontinued and 31% not started. So majority are in progress. This will change from quarter to quarter as things kind of fluctuate, as progress fluctuates. We will see that darker green, the 15% continue to increase as more activities are completed. But again, this is a 5-year strategic plan. So we have 5 years to get this circle as green as we can.
And I think the next slide has that comparison too, right?
Yeah. So the next one shows just kind of the difference between Q1 and Q2. So we could show the progress from quarter to quarter. So just kind of some high level summaries. You can see Q1 on the bottom, Q2 on the top. We had fewer activities. I'm trying to remember activities versus objectives. Fewer activities that were indicated as not started. We did have a couple more that were behind schedule. We also had more that were in progress in quarter 2 compared to quarter 1. 2 more activities were completed in quarter 2. Then we did have 2 additional activities that were discontinued.
I think one thing to add to this too is just like, as we've said in previous meetings too, the obvious context and the obvious asterisks with all of this, that as we move forward in the year and as we head into next year with planning, we anticipate we might see that discontinued pot continue to grow depending on what decisions are made with certain strategic priorities or strategic specific objectives or activities. So sorry. to interrupt.
Oh, you're right.
So, and back to the MEL framework, I'm assuming these reports are much more focused on the M at the moment. So you guys will start to move to reporting for ENL.
So the evaluation would be more of those end of the year, those indicators, those will be, right now, they would be annually collected. So at the end of the year is when we'll start collecting those and then get those at the quarter 4 report. So that would be more of the evaluation piece.
Okay. So we should expect to start to see the measurable results from this activity by the end of the year.
Well, some of them.
And learning is reflected in like a narrative? Is that what the learning would be?
Well, we don't have it like parsed out explicitly into this is the monitoring, this is the evaluation, and this is the learning. The learning would be kind of wrapped up into, yes, into some of the narratives that the priority leads provide. Yes.
And to clarify to your question too, the Q4 report gets collected by end of this year, but we share with you all, I believe in January.
Oh, yeah.
Okay.
Okay. Timeline.
To the timing to allow for year-end data, like most accurate year-end data, but yes.
And then Armando, that timeline feeds, okay, that's an okay cadence for you to feed into the budget process.
Yeah, that's what we're trying to work on, making sure that we can report, because I think we've done a lot of work with priority-based budgeting, so we want to be able to feed the costs, the ROI is really what we're really looking for to make sure it fits, yeah.
This year, we're a little out of sync, but that's one of the things we've been talking about for the next budget book is like figuring out how do all these cycles line up so that data feeds in from one to the next to one to the next.
And so what we're doing is some baselining, because we have a budget book that we have to publish. And that was one of the recommendations from the GOFA when we went out for the award was our strategic plan or our metrics. So they're working with providing those information for us, but we're putting baseline in this year. So it's like, you're not going to see the data, but next year when we publish, we should have data in there.
Great. To speak to some of the successes first, again, these are from quarter 2, but I can give some different updates from quarter 3. So a little sneak peek of what you'll see next month in the report. So quarter 2, mental and behavioral health. So they were working on an anti-stigma campaign, and in quarter 2, they hired the contractor that they were working with. And this is taking the state's campaign and localizing it. So working with Boulder County community members and videotaping messages that go along with the state's campaign. Broomfield did something similar, I think, a year or 2 ago. So the update from quarter 3 is that they've worked with the contractor. I think the videos are all recorded. I don't know the launch date for this campain. Get that to you. Oh, tomorrow?
That's this week, I think.
Fantastic. So they'll be launched tomorrow.
I'm not, I can't, Sean's not on, but it's
Soon.
it's very soon. I mean, everything's all set to go.
Awesome. Yeah. So that's been an exciting development in the mental and behavioral health world.
Just as an FYI, it's a Let's Talk Colorado space, but all the videos are all local and things like that. And they turned out really, really good. So it was good.
Community engagement, quarter 2 is when Megan Gatos, the consultant, was hired. She has been very busy from quarter 2 to quarter 3, really trying to set a solid structure and foundation for our community engagement work, kind of getting the landscape of where we're at and coming up with a proposal of where we can go next year and moving forward. So you'll see a really good update in the quarter 3 report from Megan. Health and racial equity. So quarter 2, the HEC began developing the training policy for all BCPH staff. Since then and into quarter 3, that policy is developed, drafted. They held staff engagement sessions to get feedback. And next steps are to meet with management team as well as the county attorney's office to finalize all of that. Rolled out in 2026. And then STS, a lot of processes were moved forward between quarter 2 and quarter 3. just a couple of highlights. The funding intake form was implemented. Obviously, priority-based budgeting was a huge part of all of that. That process helped us develop our 2026 budget. Another part of STS is focusing on workforce culture. And so Indira's been leading the charge of the managing workload guidelines. So those are being shared and implemented. And then all the strategic priorities, as you heard last month, we've been working with them on the strategic priority indicators. So continuing to work with them in Q3 to finalize what we can collect for 2025, and then we'll be collecting that data at the end of this year. Some challenges. So these challenges have been reported and have existed since the beginning of our strategic plan. So this is not all due to any of the challenges we're experiencing currently. Obviously, they're exacerbating some of these, but capacity continues to be one of the main challenges reported, both from priority leads experiencing capacity challenges, managing their regular job duties. And for a lot of our priority leads, the work groups are, and this work might be on top of what their regular job duties are. And sometimes the capacity issues or challenges are at the work group level. So the staff that are on the work groups trying to move this work forward. Again, sometimes it does line up very nicely with their regular work. Sometimes it's additional work. Because we have priorities that overlap as well, there are some staff, a handful of staff that kind of work on multiple work groups because of the nature of the work. So capacity is a challenge. Especially these last couple of quarters, change saturation, change fatigue. There's a lot going on in our agency. There's a lot going on in the world. So continuing to work on changes. Sorry, continuing to manage some of the capacity issues with the change saturation. And then Kelly has mentioned that a lot of this work, it's a culture shift for the agency, especially around the reporting and kind of getting that cadence down. So common challenges throughout the implementation of the strategic plan so far.
So one comment I will make on this in my own experience in strategic planning is that if the staff feel like this is off the side of their desk, it is probably not aligned to the strategic need of the organization, meaning either their work needs to shift or that priority needs to change, because in my mind, the actual strategic priorities of the organization should be what people are working on in many cases. Now, there's going to be examples where it's a new special initiative, right? But I think that's just an interesting observation and something that maybe should be filtered into the next decisioning around strategic priorities, right? Because they should not, in my mind, most of them should not be off the side of the desk.
And I think Lexi's comment earlier kind of speaks to this of the way in which these priorities were identified and the work within them was identified rather than building from the ground up, was more top down. And so I think part of this is we're also in this shifting and growing phase because of the priority-based budgeting process, because of the reorganization, because of some of these shifts. Some of this is becoming more in alignment, and some of it by necessity may shift and come off of people's plates. So I think it's a great point and definitely something we are very mindful of as we head into the planning cycle for next year. But yeah, I think some of this is stuff that we can address. Some of this is kind of the norming and storming phase. Sorry, go ahead.
Go ahead.
So I think the other thing I would add is I think it's an opportunity to kind of reset because of all the changes. So I think we've had that discussion. I think Lexi's brought that up before, is I think now that we're at the end of adopting this budget, I think we have to make sure that we're aligned with the strategic priorities to your point.
Yeah, it should start to feel more like it's not two separate things. It's two separate conversations going on. Yeah.
Yeah, I don't, okay, no, Lexi jumped up. Yeah, I just want to say this, and I keep on harping on this, so I know this maybe sound like it's too much, but this is a really culture shift. The way that people, and I think that we have made significant, not we as in SIB, but we as the agency have made significant strides in people starting to understand what the strategic plan is and how do my programs connect with that. And some of that works with the KPIs and how we're building those spaces in. I mean, one of my favorite stories when I first joined, I was told as I was in Elisa's position, and I was told on several occasions, oh yeah, we have strategic priorities, but we deal, somebody else does that. And they're right, it has to be sort of as an agency movement, right? And then and so we have to also work with programs to help them understand where they contribute, how they contribute to that, what their work does, I think, in that space. And I think that that's something that we're gonna have to continue to do.
That makes sense. And also giving them a voice if they feel like it's misaligned, right? Like
Totally.
maybe that is not the priority based on what they think the community needs might be, as an example, or whatever that is. So yeah, no, but I appreciate that, Kelly. It's aligning this is really challenging, but I think when there's true synchronization with the goals of the organization, with the budget and strategic priorities, everything works really well, but it's hard to get there when you're at the stage. So I appreciate that.
Well, and I guess back to then our earlier conversation about all the reporting, like again, something, and you're going to be on the committee, right? Keep motioning you. No, but just to ensure that the feedback loops and accountability are really helping us get what's useful information, and also that we're not just doing busy work along the way. So.
I just want a quick time check. Do we know how much time is on the agenda? I have a few more slides. I just want to gauge how much time we have.
I think you're fine. Yeah.
Okay. So looking ahead to some of the milestones in the next 6 months, as I mentioned, the Q3 report is being completed now, or being compiled now. You will receive that in November. We'll also be administering our staff survey in November, which feeds into the strategic priority indicators. So we'll be collecting what's not on the annual survey, the other data we can collect for 2025 for the strategic priorities. We'll be collecting that December. All of that will feed into the Q4 report that you will receive in February. Also in February is when we will schedule an annual review meeting. So we had one this past February. That was kind of our first annual meeting. And the goal of this is really to get management team and our priority leads together to make some decisions about how we want to move forward just kind of for the next year. So these are making bigger decisions around either the goals or the objectives, not necessarily at the detailed activity level, but do we need to switch direction? This past year, we really didn't make any major changes. As has been mentioned before, I do think in 2026, we'll be making some significant changes to the priorities and goals and objectives. And then the detailed implementation plans, the last item on there, those are the action plans that the priority leads and work groups complete to kind of outline what the more detailed work that they want to conduct over the next year. So they'll start developing them at the end of the year, but given some things might change in February, we won't finalize those till kind of the end after the annual review meeting. Okay, so the next 2 slides are the last ones I have, and then we can talk about any further questions or discussion. And these were also in your board packet. So these were 2 questions that were asked about the strategic priority indicators. So the first one was, we had mentioned that we will not be able to collect data on all of our indicators for 2025. So this is the breakdown with each priority, and then the total at the bottom for both the percentage and the numbers help provide some context. So this is what we're looking at and what we can collect for 2025. One caveat is please don't hold us to these numbers exactly. As we start to collect the data, there might be a few that we realize we don't have the capacity or it's not feasible to collect, or maybe it's going to be very incomplete data at this stage. Some of the indicators, again, it may be incomplete data. We're going to start building and collecting what we can. A couple of notes, health and racial equity, we can ideally, we can collect all of our indicators because most of them are coming from the annual survey or some internal documentation that we think we can get. And the same with STS. Annual survey questions are feeding into a lot of those indicators, as well as some documentation that we are pretty sure we can get from our ANF colleagues. So those ones have higher percentages for 2025. Why?
And I think it's fair to say, with our community engagement work, that's the one with the lowest percentage, but also again, that is work very much in progress. I think, I don't want to speak authoritatively here because I know the people in the room have been speaking this more, but I know Megan Gatos is on contract for a period of time. That contract will end at some point, and so I think that's kind of reflected in realistically what can we capture for, in that case, that strategic priority in particular.
And then the second question was about the breakdown of the output versus outcome indicators. So we have that breakdown again by priority, and you can see the totals at the bottom. So a couple of things it's important to get to make sure we're all operating on the same definition because we can define things differently. Apologies, I am going to read this because I don't want to misspeak and I don't have this one memorized. But outputs, we are considering the quantity or quality of the activity. So kind of the how many of X did we do? How many individuals did we serve? So the tangible products. Outcomes, acknowledging that we have short, intermediate, and long-term outcomes. Changes in participants, communities, environments, or systems. And they can occur, again, short-term would be the changes in knowledge, skills, and attitudes. We think we can get some of those. Intermediate, changes in behavior of individuals or organizations and systems. We can get some of those. Long-term, changes in environment or the population health status. We are not measuring the population health outcomes with our evaluation of this. Those would be the goal level kind of indicators that we're monitoring, surveillance a little bit more. These outcome indicators are not the population health indicators. So we did want to kind of make that distinction. That's what we're meaning with the outcome indicators.
Are we eventually getting there? Like, is that, when you say that, is that for the near term, or is it that is not something we're ever going to really be producing?
I mean, for this strategic plan, it's only 5 years. I don't think we're going to see changes in population health status because of the work that we're doing. We're not going to be able to say that we've made those changes to the population health.
But I think to your question though, so for our goals, we do have population health indicators there. We do monitor that data. But to Rachel's point, it's not on evaluation. We're not necessarily tying that to the specific activities and saying we alone with the strategic priority have reduced suicides in Boulder County, but we do monitor those population health data at that goal level. Again, based on whatever cadence there are. So for a number of them, it's updated every 2 years. So when those data do become available, we do have that data as kind of like a North Star for this work overall.
Are each of our outcome indicators tied to a population level indicator in some way? Like, does it feed into or align to population? Because I see what you're saying too is like, right, what we're trying to impact as a public health department is often population health. So how are we?
I might kick this one to our colleague Eleanor of how she would want to do. I want to make sure I don't misrepresent kind of, because I see what you're saying. Eleanor, I see you're on. Are you willing to take, there you go. Eleanor, did you hear that question or do we need to repeat that one?
I did hear it. Thank you. We do have goal level indicators for each of the strategic priorities. And we had mentioned that of the strategic priorities, 3 of them are a bit more programmatically focused. And then the other ones are a bit more internally focused to the organization. So the programmatically focused priorities, certainly those are all tied to some population health measures there at the goal level. It's a little bit different for the strategic priorities that have more of an internal focus. We have tried to get at the population of interest to at least to almost offer context for why those are the strategic priorities have been selected, but they're not necessarily for those internally focused strategic priorities. They're not really traditional population health measures.
And did you hear the question too, Eleanor, of, do you want to, I don't want to misrepresent your question, the last one that you ran, the last one you asked, or did that answer it for you?
Yeah, no, I get it. Like, I understand that some of these are internal operational outcome indicators. So I mean, I'm trying to think of the evaluation of the effectiveness of a public health department, right? And like what, how do we, and it kind of gets to like that narrative, how are we talking about impacting our community? And some of it is if we are a well-run organization, we should be able to impact community health outcomes. So I understand that there's several layers in between what our operations are. And I'm just trying to think of how this comes up in conversations also with like our funding partners, right?
Exactly. Well, and then there's just broader issues, I think public health faces right now in the context. So Amber, I think this is potentially for you and Steve. I think this is a subcommittee. Well, I mean, I think we need to have a conversation. I think also about the weighted sort of internal versus external and how we really think about moving the needle with population health. And are we being aggressive enough about it or assertive enough about it in the way we're kind of running this? And so I think this is like that bigger strategic question for the strategic subcommittee. And I think that's where these conversations will occur. And I think I think you guys are picking up the flavor of what the board is concerned about, right, in terms of the direction of where this is going ultimately. But it is, I also want to acknowledge it's a very stepwise. Probably we can't get from A to Z in, 1 month. So but yeah, I think
As nice as it would be.
right. So this feels like a good opportunity for us to continue to like kind of push.
This is why we're going to have a strategic plan subcommittee is actually so that we can ensure that these work, like this is not a one meeting conversation.
And I do think, not to jump ahead to who will be on the subcommittee, because we still have to talk about that, but I think Amber, your participation along with Stephen's going to be incredibly helpful, I think, from a truly public health measurement perspective. So yeah.
I just wanted to say that the population health indicators, some of those we're not going to be able to move, right? But there's going to be ones in the mental behavioral health ones that I think we should focus on. But some of them are very internally focused. And so the STS, the emergency preparedness, much more internally focused. They're not going to have that. But in the mental and behavioral health space, I think that should be our ultimate goal because we do have the youth data, right? And we do have the adult data, and we can keep track of how our efforts are having an impact.
Yeah, but even like, I would just say, Indira, this is me getting way over my skis right now, way over, but even on emergency preparedness, I would argue that there's got to be some external facing measures that we can look at as a community to say, did public health kind of rise to the challenge, right? And were they prepared internally for the external? And how do you measure that? And so I'm going to step back now because I don't know what that is and I don't know what that looks like, but it feels like we should challenge ourselves to think about how this then translates externally, right? And so easier said than done, and I'm not an expert here.
So I worked with, I did population health data monitoring at the state. There's not a lot in the emergency management area, but there are indicators in the mental behavioral health space that are pretty standard. I do think though, it does make a question of at some point, and I'm sure that the HPE team would not like me saying this, do we do a community-wide type of assessment for things where we're having these direct impacts all the time, but there aren't good metrics to measure and see. Right.
Or even like what are our after action reporting? How it is that impacted by our emergency preparedness? So it doesn't have to necessarily be population level indicators, but again, what is the impact on the community?
Yes,
and our ability to meet those needs, right? So
And I really don't, I don't want to derail us any further. I do think that this philosophical conversation though is very timely. This is really not a conversation for this meeting because it's a much larger one, longer one, but our team is already starting to look ahead, right? What will our next community health assessment process look like? And I think this ties into some of these larger philosophical questions of one, what does that assessment look like, right? What data are we pulling in for that? But two, also what makes sense for us to be including in our public health improvement plan versus our strategic plan? Like how do those align and what are the differences there? So I plant that seed, recognizing that I'm not trying to drop the bomb in the room and then walk out. But I do think that this is a nice and timely conversation that some of our community partners are also interested in having of how do these pieces all fit together? How are we aligning these pieces and able to tell that story of the impact we're having in public health? Sorry, go ahead, Kelly.
I want to check this too, because I agree, this is a good discussion to have with the work group. And, you know, I mean, so some of the monitoring evaluation work, I've done work, and it's all overseas, but, you know, with a captured population on, for example, nutrition. And I know we were the only people providing that support. And that was an easy one to see malnutrition rates go up and, you know, or up, in this case, down, improve. Let's just put it that way. I think thinking about how we use these, how are we impacting the community, but understanding like we are contributing to, for example, but not,
The only contributor.
yeah, we can't, the environment's so huge and our capacity is so small in that space. So, but understanding that space, I feel, and being able to speak to that, I think is really relevant, right? Which we can do a better job at.
Yeah, I agree. And Kelly, I was gonna say that too. I think that some of this is about the communication, right?
Yeah, it's just we have a story to tell.
We understand
Yes, we
this is
do.
what we can measure. This is what we can't measure, but we know that the trend is headed in this direction. And we're a part of that. And, you know, just really trying to, because I understand there's like actual deep statistical math under this. That's very hard. You know, you've got to start to parse out like the confounding variables and all this too. So again, way over my skis, but I think, I think there's something really, there's an opportunity here, right? I think, and I want to, like, I think this is even for broader public health, which is how to tell the story in a more meaningful way and how to show those impacts in a more clear way to communities. So I think it's a great opportunity for us to potentially lead the charge on something similar to priority-based budgeting, right? Where a lot of other counties are now asking us for our methodologies. So like, you know, we can show up and do something a little different this time. And I think it could be impactful. So,
Eleanor, yeah.
Go ahead, Eleanor.
Thank you. I was just going to also say that this kind of conversation, incredibly important, and it's going to inform other data collection efforts that we put into place in coming years. As an example, in the strategic priority indicator list, some of those that we will not have for 2025, but we certainly hope to have later on, are views from community partners on how BCPH has been helping move their work forward. Yeah. So it's not objective population health data, but it's that interim and from a different perspective, not just us reporting this is what we see ourselves doing, but it's also going to get a different view of what do our partners in the community see our work moving things along. So that may be a useful intermediate as well.
Thank you for that, Eleanor.
And just the time check, yeah.
Yeah, I was gonna say, this has been a great conversation. Is there anything else you guys wanted to cover?
We already kind of talked about.
Oh, we gave you a lot.
Well, no, specifically like thinking about, and again, subcommittee talk.
Yeah.
Anything for these quarterly reports specifically, since that's what some of this content was focused on, wanting to make sure that they're useful for you all and for our leadership as well. So anything.
Let me just make one last comment. Yeah. You know, I want to thank Rachel, Eleanor, and Elise in this space. It's a challenge, you know, with this, everything is new that we're moving forward. And this is not going to Oscar speech or anything like that, but thank you. You know, Lexi's been super great with us. And we've had plenty of knockdown discussions and disagreements. And I think that's been super helpful. And the fact that y'all are interested in this space and ask the challenging questions means that you care about it. And that's a big part of moving the space forward. So important.
I want to throw in one quick update to you all around our new team member. I think you may have seen in the director's report, but as it is timely to our discussions around data, really quick wanted to share that we did hire our population health epidemiologist, which we're very, very excited about. Ian could not be here this evening. His wife is due literally any day now. And so he had an OB/GYN appointment this evening that he's attending, but hopefully we'll invite him to a future meeting so you all get to meet him. But we're very excited and he is very much supporting the great work that Rachel and Eleanor and other folks in the agency are doing. So
Great, I'll leave it there. And let you guys take control, or do I stop sharing?
We can take control.
I didn't want to stop sharing,
Okay.
like everything goes black. So
Thank you. Well, thanks, you guys. That was great. And I know this is a work in progress, and I'm going to say thank you in advance to the subcommittee and all the work that's going to go on there as well. So. All right, I think the next item number 4 is the 2026 budget. We're going to talk about service impacts, federal shutdown, and WIC contingency planning.
Thank you. Lexi Nolan, Executive Director of BCPH. We wanted to provide the board and our community with an update, excuse me, on the budgeting process and how it is impacting agency staffing as well as our service level expectations in the community. I think everyone knows that public health is very much under a microscope in terms of funding, especially from the federal administration. We also are feeling pressures from state funding sources, county funding sources, and to just put a fine point on it, our local nonprofits are certainly under a lot of strain too. It's a combination of kind of policy decisions at the federal level as well as economic shifts. We're starting to see some negative economic shifts and decreases in tax funding, et cetera. And of course, this those things go hand in hand with community impact. So at the same time, we see impacts on our funding, we see increases in community needs for our services. So that is always kind of the vicious circle that we get caught in. And we've taken a very careful look this year at our budget. How do we create a sustainable budget? And what does it look like in terms of how we strategically arrange ourselves as an agency and in relation to the community? Next slide, please. So I think you're all familiar with this slide. This is the budget source and use, and it compares 25 and 26. And the good news is that we are well on our way to a sustainable budget. We are reducing our reserve spending from $2.1 million in 2025 to around $766,000 in 2026. So that is an enormous improvement, and it's taken a lot of work to get there. Next slide, please. I want to review the staff changes with you. We are moving from 172 staff to 141 staff, which is the FTE equivalents of that are 161 to 131.3. This includes 7 layoffs, 8 term endings, 3 positions moved to hourly. We have been able to reposition 6 of our staff that whose positions were being ended into either reassigned positions or an internal hiring vacancy. And we had a very specific initiative that we developed to support that internal hiring process. And we also had 7 positions that we won't be filling that were due to attrition. So we still have an indirect deficit that we are working to address and are waiting for information on the federal budget and revenues because, of course, as our budget goes down, as grants and revenues decrease, it will also decrease our indirect funds, and we need to keep those aligned with each other. Finally, the county announced in the last couple of weeks that it's going to be offering a voluntary service incentive plan for retirements. It's not really clear what the impact and implications are yet for our staffing needs. The deadline is December 1st for staff to opt into that. It is an initiative that is open to staff with 15 years of time with the county. And it provides a small payout depending on the amount of time with the county. We will be watching that closely because we feel like that also has implications for decisions we make about how we continue to staff, what positions are critical, and how we'll move forward in that space. I just want to take a pause here and see if there are any questions from the board.
No, I don't have any. I don't think there are any questions, Lexi, in the room. Landry, I didn't want to leave you out if you had any questions.
No, I'm good. Thank you. I'm good. Thanks.
Okay, thanks. Next slide, please. So we have been able to make a number of changes to support efficiency in the organization. We have consolidated our food security initiatives under HEAL, specifically. HEAL is healthy eating and active living. Specifically, we've moved our farm to ECE work into the other foods under HEAL with the other food security programs. We feel that this will help create some economies of scale for staffing in particular. We have also moved the Child Care Center and K through 12 inspections under consumer protection. We have staff in consumer protection who have experience in those inspections. And this again gives us an opportunity to create a team that is more integrated and is able to lean on each other a bit more. We are merging our Oasis and Generations programs into a mental health focused youth development and leadership program. Oasis is our nationally awarded program that focuses on LGBTQ youth and providing supports and creating protective factors for them for mental health and general success in life. And Generation off of our Genesis teen mother support program. Generations focuses on Latina youth and providing similar kinds of services. So we really saw a lot of alignment between those two programs in terms of the aim and the intention, and saw it as an opportunity with the downsizing of the staffing numbers to create one team focused on mental health. We are also merging the community substance abuse program, prevention program, and the tobacco education program into a single behavioral health prevention program. We do feel like we may still continue to use some of these names because they are well known to our funders. But what I think is important to recognize is that we need to have a critical mass of staff and programs to be able to effectively do the work. And that's what we're working to achieve. We will be consolidating the immunization services and staff health within communicable disease. You all probably remember that during the pandemic, Carol Helwig, our communicable disease program coordinator, I think she was overseeing 40 people or something like that. And our immunization services team was, a couple of dozen at least. And that's just not the case anymore. With the COVID funds kind of exiting, a little, obviously a lot less stress in that particular area. Our staffing has decreased. I will say that this is an area that the workload has increased over the last few years, particularly with communicable disease. We think people really learned during COVID that they're supposed to report conditions to the public health department, and they're doing a great job. And that has created some pretty significant workload increases for that team. So we're trying to keep an eye on that. And finally, we are moving our environmental hazardous waste response, which is required work largely from our environmental health team over to our emergency management team in order to try to help balance workloads in those areas. Any questions on our reorganization work?
Questions, Lexi? Thank you.
Okay, next slide. So this is our new org chart. It is teeny tiny. There is a lot of text on this, and it will be available obviously for you after the meeting to take a closer look at. We were really trying to just capture for the overall agency kind of where the staffing shifts happened. There are a few things that you have to know the context to understand what the impact was. For instance, the child health promotion team in family health moved over into environmental health, into those inspections and into the food security work. So you see, quite a significant dip over there, and you don't see a big dip in environmental health. And so that kind of reorg shift helps to explain that difference in the staffing levels. Community health clearly took the brunt of this. This was not unexpected, although it is certainly unfortunate. Our community health division does an enormous amount of our equity work, and those grants have been challenged lately. They are doing a wonderful job of taking an aggressive approach to grant writing right now, and we certainly hope to build those teams back up. Another space is administration and financing had a significant decrease. Again, during COVID, when our budgets significantly increased, we needed additional admin and finance staff. That is not the case anymore. And also, I want to give some kudos to Armando for having implemented a lot of financial controls and efficiency measures that are going to help us be able to do our job really well with a much smaller staff. Finally, the strategic initiatives branch. You don't see a big change there, although it's a little bit bigger than it looks there. We did let go of our MBH coordinator and a community engagement position that was underneath them. It's not reflected on this chart, but that did occur this year. Excuse me, sorry. I will also say that the strategic initiatives branch, particularly communications and health planning and evaluation, those teams are relatively small for an agency our size, especially compared to the size of teams in other LPHAs. So we really felt like maintaining those teams is a critical part of the vision that we're trying to work towards in BCPH around really having an integrated approach to our work, being able to better measure, evaluate, and communicate our work to the community, et cetera. So I'll take a pause here and see if anyone has any questions about the org chart.
No, I just, again, really appreciate all the work that has gone into looking for efficiencies, looking for how we can continue to provide a high level of service to the community, and also acknowledging that this is really painful for the organization to lose staff, especially those who have been giving so much to the community in their roles here. So I appreciate all the work that went into it.
Thank you. Okay, next we just want to highlight a few of the areas where we do anticipate some service level impacts. First, in relation to the regulatory work, I mentioned that our communicable disease and immunizations teams have shrunk a bit. They are planning to do fewer immunization clinics out in the community, and they will probably need to prioritize outbreak responses. I think everyone here recognizes that public health is not great at doing B-level work, and we always want to do everything we possibly can for the community. And so we are working hard to figure out what the solutions are for us to do the most important work and to keep workloads manageable for our staff, because it does not do us any good if we burn out our staff. So trying to balance those two things is really important. The other regular area of regulatory work, we do have some decreases in the food inspections, air quality, childcare permitting and inspections. We'll probably just see slower turnaround there. We don't anticipate there will be a big gap, maybe a little bit more prioritization. We are looking at supports like creating surge teams to support, for instance, if we have a massive outbreak, communicable disease outbreak, we have EPIs across the agency who could be pulled in to help with that work for a short period of time. So we are looking at those kinds of contingency plans. Would relieve some of the work. That would relieve some of the workload on our staff. I'm sorry, did I cut out for a minute?
Yes.
And I think we
So
got
we
it.
are,
Yeah, don't worry.
Yep, we got you.
It was momentary.
in relation to governance, we mentioned we have kind of a skeleton admin and finance staff, comm staff, health planning and evaluation, and IT. This is partially due to that $1.5 million deficit in indirect. And we will be continuing to look at how do we right size those teams, given the indirect funds are likely to or possibly could go down further. Again, just mentioning, we've implemented a lot of budget and finance control mechanisms between Armando and Desiree and some of our other staff, and looking at those automations and efficiencies. In relation to mental and behavioral health, we will have less programming and less reach in relation to prevention, early intervention, especially for our Latina, LGBTQ plus youth groups. As I mentioned, the team is doing a great job of really going after grants, and we are looking at other potential new revenue sources in that work. Mental and behavioral health is Boulder County's community priority. And certainly in the state of Colorado, mental and behavioral health does not perform as well as a lot of other states. This area is the priority for a lot of LPHAs in the state. And so we don't see this as work that's going to go away. We see this as a temporary pause while we rebuild the work going forward, because it's too critical to let go of.
Lexi, is there
finally-
potential, sorry, I don't mean to cut you off, but is there a potential revenue for those programs if the mental and behavioral tax were to pass?
I think so. Yeah, I mean, we are certainly keeping our fingers crossed, but we'll see.
And
mhm.
we do have, you know, when you look at the MBH roadmap, public health is really charged in that prevention, early intervention and harm reduction space. So,
Which are all targets of the mental and behavioral tax.
yes.
Yeah.
Okay, and finally, in the climate work, we did sunset our climate justice and healthy homes programs. It is heartbreaking, but the funding landscape is just not there right now to be able to invest in these areas in a way that we feel would be most meaningful. Some of our community partners, particularly in the climate justice work, have recently disbanded too. The combination of policy direction of some of our federal agencies and reductions in funding have made this work much more difficult for us to get off the ground in public health. And so again, this is an area that we want to re-examine when the funding environment is more supportive for them. Okay, next steps. We will continue to emphasize internal hiring as much as we can. We do have a couple more positions that we hope to recapture some of our staff that otherwise would be leaving. We do want to make sure that we are right sizing the workloads. As I said, it's no one's any good for anybody if they are so burned out they can't work. And we have to be realistic about what we can provide for the community. We will also be reaching out to our key community partners and talking with them, making sure that we're aware of any unintended consequences and that we're coordinating with them to minimize those as much as possible. And then we will also continue to make small budget adjustments as we learn more about future revenues. Which brings us to the last topic of the evening. Armando, do you want to take this one?
Sure, definitely. Thank you. My name is Armando Guardiola, Director of Administration and Finance. I just wanted to give you a quick update on the WIC program. About a month ago, obviously with all the financial impacts that the program is having, and because of the closed government shutdown, this program is fully federal funded. And so with that, we originally had to wanted to talk to you all about contingency planning, but we did get some good news last Thursday saying that we'd have additional funding in November. So I don't want to talk too much about the contingency because I think we're going to go back to the drawing board and kind of reassess that because we do have funding now for October and November. So I will be coming forward in November's Board of Health meeting to kind of discuss the contingency plan. It's not going to change much then from what we discussed in the budget committee subcommittee. But I just wanted to kind of give you an update that we did get some good news. So we do have funding for October, November, and then I'll be bringing back a contingency plan in November. So just a really high level, just kind of give you a quick update.
Let's hope that we have some movement before that meeting.
Right. Any questions on that? Very high level.
Yeah, and we're really appreciative to the state for stepping in and providing a month of extra funding, a month of funding beyond whatever the feds are providing, not just for our staff salaries, but also for our client benefits. That was a huge move on their part, and I applaud them for it.
That's great. Armando, just so I understand, when did the federal government actually approve October salary and client benefits? Was that in October?
So actually, originally the state was going to cover the October, but last week is update was they're covering the October. They're reimbursing the October and the November.
So the feds are covering the October and November. And so has the state
Just October.
1 month.
just October?
State's doing November.
States covering November?
Well, we're hearing that they're going to reimburse, even though they're going to cover our October,
Yeah.
but they're getting reimbursed by the federal
Feds.
government
In October, for October.
for October.
And they'll
And
just
when
shift that
did we
funding to
hear
cover
that?
November.
What's
Yeah,
that?
I'm just trying to understand timing. When did we get that news?
Thursday.
Yeah, that's what I thought. Okay, really recent.
Yeah.
So they're.
So it's in the middle of October and they're, okay.
Yeah, the state's going to obviously reimburse us, but they're going to get reimbursed from the feds. And then the feds are going to reimburse for November also.
So this is how we call a fluid environment.
Yeah.
And the appropriations is coming from the tariffs
Oh, wow, yeah. Okay.
because they don't have any other appropriations.
Using that to pay the military too, I think, right?
Yeah.
They're talking about that, yeah.
And some
I think they.
special positions on the FBI.
Well, that's good news.
Yes. So we'll keep you up to date as, like you said, it's very fluid, coming in really fast.
Interesting and helps to see you guys.
Committee proposals.
Okay, we are moving. Any final questions on the previous topic before we move on?
So thanks for walking us through it.
You bet. Okay, next slide, please. I first of all, before we get started, I have to do a mea culpa. These are actually committee.
Chamber committees, not
because
subcommittee.
we don't
We don't
have
have any
any committees,
committees.
so they're gonna give them a promotion and move them up to committee status.
You guys do that? Yeah. Right. We approve. Yep.
Unless you want to form another committee.
No.
Then we can have some
And
subcommittees.
then we just have baby committees under those. Thanks.
So for the past couple of years, we've had two committees, the Executive Director Oversight Committee, which sets the annual Executive Director goals and performs evaluation, determines salary. We understand that the Board of Health representatives going forward in this space are going to be Amber Johnson and Landry Fagan. But if there are changes that the board makes, that's all good. We have
Lexi,
also.
I don't,
Mhm.
I'm so sorry to interrupt. I actually think that we, and Amber, I'll let you speak to this, but I think we had put Stephen and Landry on the ED Oversight Committee, or that was our recommendation.
I will make that change. Thank you.
You, we can confirm with him. Yeah, I think that is correct, but
Okay,
we can
great.
make
Thank
changes
you.
as needed.
For our budget committee, we are proposing to expand it to be the governance and budget committee. Obviously, it has previously overseen the budget work. We are proposing to add governance issues such as updating the Board of Health bylaws or other issues that may come up, perhaps reviewing the IGA before it goes to the board, et cetera. We just see some additional roles besides budget that this committee could effectively tackle outside of Board of Health meetings. And those representatives would be Lindy and Morgan. Okay. Next slide. So as we discussed last month, we are proposing to develop a strategic planning subcommittee. The goal is to really ensure an aligned vision and path forward between the board and the BCPH staff by creating a more structured forum for discussion, really allowing the board to engage more deeply with staff and community stakeholders on long-term goals, measurable outcomes, resource alignment, those sorts of things. My understanding is the board representatives in this space are going to be Amber Johnson and Steve Yoon. They will be expected to serve a consultative role with agency leadership, and there we have listed a number of spaces that we consider key areas of focus. Of import, it's not limited to our current strategic priorities. It really is broader than that. You'll see issues like strategic communications, environmental scans, reviewing the outputs of community health assessments, making sure that health and racial equity remains central in our work, really getting our policy and systems change and community engagement work effectively launched and integrated into the agency's work. So I am happy to take any questions, comments.
On the department side, who will be on this committee?
It will, I mean, I think consistently you will see the director's team. And I think that you will see staff in relation to what the topic of conversation is. So it could vary quite a bit. Obviously, we would want the communications team to be there for conversations around strategic communications. But we also have data and evaluation, which would be more in HPE's area. If we're talking about strategic priorities, it could be the work group leads, as well as the HPE team. Our policies and systems change work is led by Tessa Hale, community engagement, currently led by Megan Gatos. So I think it'll vary kind of depending on the topic. And so I think getting the agendas established is going to be really important for creating a sense of continuity of the discussions and building towards something that really stays cohesive.
Do we just work with you for scheduling like a standing meeting or?
Yeah, once we,
Okay,
now that we finalize these, I'll.
next slide. Took us right into the next slide. Thank you, Amber. Right, so this is just, it's a proposed kind of meeting tempo. And what we were trying to achieve here, you'll see, I mean, the Board of Health meeting is every month, and we didn't want to leave that off because that is a lot of work for you all, we understand. With the exception of July, we try to take a break in July, let people take a vacation, catch their breaths, have some fun. And then kind of what you'll see in this structure, it's a little wonky for October, November. But what I was trying to structure is something where we can see quarterly meetings. We begin to move the executive director oversight committee to a quarterly meeting, the budget committee to a quarterly meeting. And then the strategic planning committee, we can have a set quarterly meeting, recognizing that there may be times that we want to bring the committee together more quickly, or more in a more timely way to address something that we're working on that has some urgency. But I would propose to start with this, with the single edition of the Board of Health, Board of County Commissioner retreat in June that I think has proven to be a very useful opportunity to connect.
And Lexi, just a few comments. I think that there was some discussion around moving your review cycle to an annual cycle to sort of follow the county now in terms of that, how the county is doing that. So just wanted to point that out to the board. And then I also think the first ED Oversight Committee, we're going to try to do that in November because Stephen's coming back and we want to coordinate with him. So I just wanted to call that out. But, and then we'll start to get on that. And I think Amber and I will sort of, as the legacy subcommittee or the committee members, be attending that meeting, and then you guys will kick it off on a quarterly basis from there.
Thank you. Yeah, thank you for that reminder, Lindy. So a couple of years ago, BCPH moved to really having our evaluations in June to align with the county, and now the county has moved back. So the best laid plans. So we're going to try to move back to having kind of an end of year review of progress. And we've been working with Lindy on kind of what that might look like. And we'll talk with the current oversight committee, I guess in November. And we will have an executive session after the December meeting to have the full board be able to talk about the new goals that were adopted and kind of how the next year will look.
That sounds good. The other thing that I'm noticing is that we usually have a budget study session with the full board in May. Is that usually when that happens?
We have,
Okay.
and we could continue to do that. It may not, maybe May will be a budget study session. I'm happy for Armando to speak to this. My understanding is that we are hoping that the work that we've done this year really puts us on a path to not having to make the depth of decisions and change.
Yeah, so in a typical budget, in a
that
normal
it'll be
budget,
much this next year. Yeah, go ahead, Armando.
in a normal budget process, usually have one retreat. So it's towards and the reason why it's a little bit further along is August because of the county and the way we get decisions from them. So I thought August would be a little bit more appropriate.
Okay.
We get you obviously up to date, beginning of the year in February. What I hope to do is if we get some direction from you when you're working on the priority or strategic plan, that will help me start building a budget. So when I get to August, I have all the input that I received from the strategic plan that should be within the budget.
I think that sounds fine. And the only reason before we would have our budget meeting before our joint retreat with the BOCC so that we had that information going into that meeting. So, we have obviously done a lot of work on budget tightening. So if you think that then.
Which you should by August, it should be early August.
No, but I understand, but it'll be that'll be after we've had our joint meeting with the BOCC.
I shouldn't.
Got that on June.
Yeah, so.
That's what you asked.
So anyway, we just might want to think through that a little bit, whether or not we need to have a budget study
Absolutely.
session internally as a BOH before we have the
Definitely.
joint meeting.
I agree.
Okay.
Yeah, that makes sense, Morgan. Thank you.
And Patrick, once these are finalized, the cadence, we can put it on the agency calendar for. Okay.
I don't know if we want to meet with him in June.
Well, that's
We
it.
did it because we did it this year because we had to, because I had to do priority-based
Yeah.
budgeting.
Yeah.
But we want to wait because this year in June we met, they didn't even have a budget yet.
Okay.
And so we were way ahead of it. Yeah.
Yeah, so maybe that's something, Armando, you can make a recommendation on in terms of I mean, I don't, like, we should probably dictate.
Let me get
when
with the
we-
county to see when they're ready. Yeah, if I can get in line with the county and it's right around August, that's why I was trying to do
Yeah.
that. We'll have it before, so we might like be at the beginning of August and then we can meet with them in the middle of August.
Yeah, I just want to make sure that they have the information that we want them to have.
Absolutely.
Before they make their budget decisions and that we're all on the same page
Yep.
before we meet with them. So,
Absolutely.
yeah.
Great, Lexi, everyone, thank you for this. I think this is an exciting launch to the next phase of the Board of Health.
Indeed.
I agree.
It makes me very happy. All right, we will move. Are we ready to move to the next topic, Lexi? Anything else? Okay, great. Board elections, item number 6.
Okay.
Patrick, take it away.
Yeah, listen to you, Patrick. Your time to shine.
Hey, good afternoon, everyone. My name is Patrick Cannell, and I serve as the Board of Health Liaison. Welcome to our annual Board of Health office elections. As outlined in our Board of Health bylaws, we hold officer elections each year to ensure continuity and leadership within the board. For consistency and transparency, I'll begin by reading the relevant excerpts from our bylaws so that we're all operating with the same information. Bylaws excerpt. The board shall elect from its members a president and a vice president, officers, and such other officers as deemed necessary by the board. All officers shall hold office at the pleasure of the board. Board officers shall be elected annually from the membership of the board at the October meeting or at the first board meeting after the occurrence of a vacancy involving a board officer. Newly elected officers shall assume office at the conclusion of the meeting at which elected. The duties of the officers are as follows. The president shall preside at all meetings of the board, appoint committees, be an ex officio member of all committees, and perform such other duties that parliamentary custom requires. The vice president shall act as president in the absence of the president. Our current officers are President Morgan McMillan and Vice President Landry Hinman. Moving on to nominations. At this time, I'll open the floor to the board for nominations for the positions of president and vice president. If there's more than one nominee for a position, we'll conduct an anonymous ballot process. But I didn't make copies, so let's not do that. Once the board has selected and agreed on nominees, I'll request a motion and a second for approval. So do we have some nominations for?
Yeah, I nominate Lindy Hinman to serve as board president.
I second.
Oh, we're not there yet.
Oh.
We need a nomination, we need a nomination for vice president.
I will, well, Landry, I don't know if you want to do the honors, but I'll nominate. So go ahead, Landry. Sorry,
Okay.
go ahead.
I was gonna nominate you, but Morgan stole it. I nominate Amber to be vice president.
And do the nominees accept the nomination?
Wholeheartedly. Thank you. Excited to do it.
Amber?
Accept, yes.
All right. Now that everyone's accepted, I formally request a motion and a second to approve the officer appointments for the Board of Health effective at the conclusion of today's meeting.
Move to approve the officer appointments for the Board of Health.
I second.
Today's meeting. Yeah.
Landry, second.
I
Okay.
second.
I'll call the vote. All in favor? Aye.
Aye.
All right. Congratulations. Thank you for your leadership.
Thank you for your.
Thank
Yeah.
Congrats.
Yeah. So yeah, just Morgan, we've had a chance to thank you recently, but just want to thank you truly for your incredible leadership over the past couple of years. I cannot imagine getting through this time without you. And you've had this amazing balance of listening to all stakeholders, including staff, including the Board of Health, and really threading the needle in difficult conversations and issues. And I really just commend you for your ability to continue to advocate for this organization in the right way. So thank you for your leadership. Truly appreciate it.
I second that.
It's been a pleasure to work with you all. I'm still
On
gonna be
behalf of the BCPH staff, I also want to thank Morgan. It has been a challenging couple of years and you've always worked with us in a way that is graceful and thoughtful and positive, and we really have appreciated it.
That concludes the board elections.
Okay, great. Are we wrapped on that?
Yeah, I think we're wrapped on the elections.
Super.
That's it. Congratulations. We'll get the website updated. We'll update it. There's a couple of other things we'll update, but we'll take care of that on our end.
Awesome. And Patrick, just need to underscore how phenomenal it is to have you leading the charge and working with the Board of Health. You're making our lives so much easier. So thank you. And I know there's lots of team that supports us as well. So thank you. Thank you. Okay, so I think we're moving on to the director's report, item number 7. Are there any comments or, Lexi, go ahead. Go ahead.
No, just a couple of things to lift up. I think you all know about the Netherland fire. It was pretty devastating for that community. They are going to have a significant recovery process. Our teams did an amazing job of responding as always. Usually that work falls heavily on our emergency management team and parts of our environmental health teams, kind of depending on what the emergency was. They did a great job of getting the grocery store back up and running really
Quickly.
quickly.
And it was
Being
over
really
the week.
thoughtful about, I'm sorry, am I cutting out?
Yeah.
Internet connections. The water quality team was very thoughtful about how do we make sure that we are preventing any future water quality issues. There were aspects of it that were a little bit complicated. So I really appreciate the team's work on that. It'll be, there will be some ongoing processes for us to continue with in recovery. I think that Amber Johnson also had the pleasure of observing at least a little bit of our North Central Regional Bioterrorism exercise. I don't think she saw the most exciting part of it, but it was really a great exercise for our staff to go through in terms of how do we simulate our response to a bioterrorism event, which, however likely or unlikely we feel it might be, obviously has transferability to other kinds of emergencies too. The staff really got engaged and we felt like it was really exceptionally run, and a lot of us felt, much more confident coming out of that exercise. So really just appreciate the emergency management team for leading that process. At Boulder County Public Health in collaboration with the North Central region. Lastly, just a couple of upcoming events. One just happened. We had our Healthy Community Awards last week. Landry was in attendance. Thank you so much for coming, Landry. It was great to have you there, and staff always appreciate seeing a board member. We also had Commissioner Locheman there, which was great. You have a write-up of the winners of the Healthy Community Awards in the director's report, but just as a reminder, Alejandro Prieto is a peer case manager with the Longmont LEAD program, really supporting folks on the street. Melissa Bonomo is a pharmacy manager at Albertsons and just did an incredible above and beyond effort to get folks vaccinated during COVID. She did something like 10,000 vaccines in a single year. She trained staff how to do vaccines. She went out into the community and it just really made a difference. It's a great testament to one person making a difference. Uproot Colorado is an organization that addresses food insecurity. Emily Larson is the Front Range representative, and they have done an amazing job of really supplementing food security work. They will take seconds from farms that can't be sold. They will deliver food, fresh fruits and vegetables to Head Start programs, just really doing exceptional work. We also had a winner that I was kind of excited about. It was actually a small business that we have worked with for many, many years, Gapter Septic Systems and Excavation. They do a lot of collaboration with our our OWTS team on septic systems, and they just really have done an incredible job of supporting the community, figuring out really creative solutions to tough issues, and always going above and beyond to make sure people have what they need to stay safe. And finally, Lisa Allen at Boulder Community Health, who has been instrumental in getting the Family Connects work off the ground in Boulder County. And Boulder Community Health is really our anchor institution for the Family Connects program. They see most of the births in the county, and we just have had a really, really positive relationship with them and appreciate their work. Last mention, we will be having our annual staff retreat on December 10th at the Avalon Ballroom. We hope board members might be able to stop by, attend, say a few words, just be able to connect with our full staff. It should be a good time.
And congratulations, Patrick. His daughter's getting married.
Yeah, this Friday.
Board business. Board business. Old and new.
Roll it in.
Yeah, there we go. Go back to director's report. Any questions on the director's report?
That's great, Lexi. Thank you for that. Are there any other questions or comments on the director's report? No, thank you. Okay. Can we move on to next item, Patrick? And Landry, just to ask, sorry, anything else you wanted to ask about on the director's report? And by the way, thank you for attending the Healthy Communities event. Really appreciate that.
That was really neat. I wish, I wish I'd been able to be there a little earlier, but it was great. And congrats on getting married. That's so exciting. Congratulations.
Okay, great. All right. Well, I think we'll move on to the last item, old and new business. Any old or new business or announcements?
None tonight.
Okay, great. Well, if there is no further business, this meeting is adjourned. It is again October 20th at 7 p.m. Thank you, everyone.
Thank you all.
Yeah.